Good morning, everyone. Thank you for attending the Second Sunday Forum this month. Today we were going to have two speakers, Dina Mascola and Jake Stockwell, but Dina's under the weather, unfortunately, and can't make it. She and Jake did a talk for the local group that's been focusing on addressing homelessness in the Valley, and that was a couple of months ago, and it was so outstanding that we decided that we'd really love to invite them to come back and talk to the congregation and the community here. So nice to see folks who are not from our church who are here today. That's wonderful. Jake will kind of cover the waterfront here of what the two of them talked about, and he's been the operations director at the Pathway Shelter in Espanola since 2020 and lives in Espanola, and he is the operations director, runs the sort of day-to-day nitty-gritty, deals each day with lots of the unhoused people and their complicated challenges. He's also co-chair of the Homelessness Action Team for the Rio Arriba Health Council. The Health Council has developed, as I understand it, a new model, and they now have different teams working on different areas, and apparently that has been a good step forward, and they do have a Homelessness Action Team, which he knows lots about. So after he talks, I'll make a few comments about the group working locally to try to reduce homelessness, and then we'll have Q&A. So let's welcome Jake Stockwell.
Good morning. Happy Sunday. It's good to be back in a UU church. I grew up UU from Raleigh, North Carolina, and Waterville, Maine as a youngster, so it's really nice to see young kids. It reminds me of my childhood. I moved to Espanola with my wife, Corrine, in 2020. And we both started working at the shelter at that time, just when the shelter started to open. Yeah, and a little bit before our time, the shelter was just a warming center, and is barely, like, we had a building, and it was basically just floor mats on the floor, and they were doing some food distribution and a lot of outreach. It was founded by community advocates and some local politicians in the area, and they got together and to try to respond to the severe homeless crisis in Espanola, right around 2019, 2020. Nina was the first executive director, and she took a break and then came back this year. I started actually as direct care, so a lot of my information that I can share with you comes directly from caring with the unhoused. I did hundreds of overnights between 2020 and 2023 before I became the operations director and got more involved with the facility. I still care for the unhoused on a daily basis, but I'm more on the management side now in keeping it going and doing a lot of community outreach with community partners and other agencies. But I would like to sort of give you a context of what Espanola has been doing and why there is such an uptick. The first trend that I saw in 2020 was COVID itself. It had a large impact on the already economic depressed level of Espanola and the Valley. The amount of death that was occurring both from COVID and then symptoms and family structures breaking down during that period caused a lot of people just to go out onto the street. And then the level of services, because of COVID and because of certain of those regulations, social services were more or less closed. So all of these impacts increased, people left on the street, and we opened our doors for very short periods of time, and it was intense. It was also during the opiate, sort of the middle of an opiate epidemic, mostly dealing with heroin, and a lot of onset overdoses. Overdoses in 2020 were the worst in the country per 100,000, something like 150 in 2020. It has decreased since then, but they were skyrocketing in 2020, 2021. And the last or the next trend that we saw in 2022 was the closure of two apartments, two of the largest low-income apartment buildings in Espanola, the Rio del Vista apartment complex, and I'm sorry, it escapes my mind, but there was two that accepted HUD. They were under HUD, and they accepted government assistance for housing. And they were closed in 2022. The first one was closed in November, actually on Thanksgiving Day. It was condemned by the county, and there was a forceful eviction of over 40 to 50 families on Thanksgiving Day. They had somewhat of a plan. They allowed some families to have hotel vouchers if basically only heads of household and their children. So if there was other family members that were living with them at the time, they were out on the street. So we immediately, as a shelter, we immediately saw an uptick go from what we had, maybe 10 to 12 regulars, to 20 regulars. We have 24 beds available that maxes our fire code capacity in the shelter, and each uptick we saw basically more than we could have capacity for our building. The next apartment was 6 months later in March, and those hotel vouchers ran out. So in March of 2022, and 2023, March of 2023, we basically saw upwards to 100 people just on the street, suffering from all sorts of either mental health or substance use disorders, or they were just stranded. So, there's what we have today in terms of basically people in Espanola on the street with nowhere to go. There's not enough places, there's not enough housing, there's not enough services to cover the amount of people that are just there, that are just out there. And so in the winter, this winter, there was several encampments that started to spring up all over the city. There was an encampment that started in our parking lot, and staff were met with a question of where do these people go if they can't come inside? And we couldn't really come up with an answer, because we didn't really want them just out on the parking lot. It's not great. We didn't want them just to set up tents wherever, and it would create basically a really unstable, unsafe, unsustainable situation. But we had no initial response. We couldn't answer the question because our beds were full. The city, their only response is to bulldoze, sweep camps. And by February, they wanted to do one last sweep in the back of Walmart. There was about 25 individuals living back there in really unsanitary. Yes, I agreed that it was a biohazard situation. There was a mountain of trash. But advocates, including myself, went to the city and we said, where will these people go? We can't handle it. You're going to send them to us. If you do this bulldoze, you will send them to Espanola Pathways Shelter, and we already had 45 tents in our parking lot at the time. So that means it would have led to about 70 tents. We wouldn't even be able to get into the doors. And so that is kind of where the Housing Action Team came about. It was a group of community advocates who were advocating for safe sheltering in place, having a sanctioned encampment with management services provided by jointly by the county case managers and Pathways case managers, and other agencies like Mountain Center providing harm reduction care, and the food pantry providing meals. It had to happen quick. The city started listening. The chief of police, the city manager, started to listen to these ideas, saying, you know what? Yes, these people are human beings. Go figure. And so we started expressing you needed to find a place for them to go, temporarily or whatever. And they did. It was a very cold February. They did sweep the camp, but they had a place for them to go, and so a group of us got our trucks and trailers, and we moved people one by one to a new spot. I know it hit the news. Maybe some of you read about it in papers, how it may have become a problem or was not a fair solution, and it was never supposed to be a permanent solution, but it was the quickest solution. Encampments are a solution for affordable housing without waiting for the affordable housing to appear, which could take years of planning and fundraising and etc. But encampments are just a quick solution. They're in place. They're like, here's services that we can provide now. We can provide a porta potty. We can provide a dumpster. We can provide outreach services on a daily basis. Case managers can find their people if they're in one place. It's very difficult for outreach case managers, for CPSWs, care support workers, to find their clients if they're dispersed all over their city. That means there's more chances of overdose. That means they're less likely to go into treatment and recovery and utilize recovery systems, and they're less likely to use shelter. They're more likely to hide under bridges and hide from police harassment and more or less undevelop themselves, right? Further go down a path that is not healing. So I do want to talk about fentanyl a little bit, because I'm going to say this is I wish the days of heroin were back, because the days of heroin were less harsh on people's bodies due to the variability in withdrawals, for one. Heroin has a 6 to 12 hour withdrawal period, so after your last dose, it would take 6 to 12 hours for you to be onset with extreme symptoms of withdrawal, whereas fentanyl, you have 2 to 4 hours. So this affects homelessness a lot, because people have to hustle for it. People can't get a good night's sleep. They can't even come into a shelter under the fear that they're going to go into withdrawal and they can't get out. Right? We are a low barrier shelter. What that means is we accept people for where they are at in all levels of their addiction. So they could be actively using. We absolutely do not allow active use inside the shelter, but they could be actively using and come in high as kites or wherever, or in whatever state of mind. We accept them. In fact, we will confiscate their drugs, we will lock them in a locker, and we will give them back in the morning. We do everything we can to get people off the street. But we're over capacity, like I said. Fentanyl has compounded all of the other issues that I just described. So not every addict is homeless, but there's probably 90% of homeless that are in Espanola are in active addiction. Leaving 10% probably either they're not addicted, but they have extreme behavioral health, mental health disorders that prevent them from finding housing security or even attempting it. Okay, where are we at? Where are we at today? Or where are we moving forward? Currently, the city has disbanded the encampment that community advocates set up. They disbanded it in the beginning of August. That brought our numbers back up. We've had some fluctuations. Pathways, when we did have so many tents, we brought on we spent a lot of time trying to help people get people into stability. And we had a lot of success. So I do want to say there's success stories out there, getting people into recovery, getting people into treatment centers long term, and finding places for people to go. Either that's with family mediation sometimes, getting families to accept their loved ones once again. We try our hardest to do that. And at one point, we went from the 48 down to about 20. And we were very close in working with the city of, or the county of Santa Fe in developing a similar program of pallet homes that the city of Santa Fe has adopted. So the county of Santa Fe got, as far as I know, 40 pallet homes. They have set up 11 so far. They have a plan to set up more, but they basically have 25 in storage. And we were working with them to come up with a plan to utilize those pallet homes for Espanola, and we are still working on that plan. But it requires some changes for us. One stipulation they're saying is we can't have multi-use. We can't have tents and pallet homes in the same parking lot. It has to either be all tents or all pallet homes. And so we drove and we tried to get down to a number that would be okay with Santa Fe County, and we were working towards a number of 15 to 20 to set them out in our parking lot. Our parking lot works because we do have porta potties, we have water, and we have facilities to serve the pallet homes. One thing the pallet homes do not have is water, but they do have heating, cooling, and some electric. So we were willing to set that up, and we are still on that planning move. But getting back to the encampment, when the encampment disbanded, we were set back. because we basically took on another 20. So we're back up to about 35 tents in our parking lot right now. Yeah, I mean, yeah, I don't know where to go from here. Maybe I can leave it to questions. And yeah, thank you.
Our congregation and 3 others have, over the last 5 years in the winter, been doing collection drives for the Pathways Shelter. They run for 6 or 8 weeks, and people are very generous, and we take down many boxes of goods. But this spring, a number of us just started saying, we are just not making much of a dent here, and a huge problem that's gotten a lot worse in recent years. So we started conversations about the idea of seeing if we could bring in a lot more congregations than our 4 and get up to a large enough number of people involved that we could actually try to seriously find a way to reduce homelessness in Espanola. So we've been having meetings now for 3 months. We're up to 7 congregations that are now attending. 1 from White Rock, the White Rock Presbyterian, and then 6 from Los Alamos, and we hope to bring in more. This past week, it's been a process, as you might imagine, just kind of slowly figuring out a plan and how to structure things and what our goals would be and what's feasible, most of all, but knowing that a lot of things just have to stay unanswered for a while. But we, this week, decided that we wanted to go right ahead and be a coalition, and our name for the group is the Interfaith Coalition on Homelessness. So if you see that coming out in future months, that's what we're talking about. We knew from the start that there was just a ton that we didn't understand, and it would be pretty crazy for us to start plunging into some sort of project without a lot more information. So 4 of us, Jeff Franzak, myself, Kim Taylor from the United Church, and Richard Skolnick from the Jewish Center, started interviewing lots of people involved on the ground in Espanola, and people who are opinion leaders. And that's been an amazing experience. Every one of these interviews just gets so many wheels turning. For every 6 questions that are answered, 6 more pop up that you wonder about. But it's been very helpful. We understand way, way more than we did 3 months ago. And so we also this week moved forward on putting out a flyer. It's in kind of the final stages of tweaking, and it will go out to all the congregations. Some congregations may choose to send it electronically to their members, but I'm hoping we'll have paper quality flyers to hand out in churches all around the county as well. The other big thing we did this week was we committed ourselves to try to raise, based on back and forth discussions Jake and I have been having, we want to raise $10,000 in the next 2.5 months from all of our congregations, probably with help from the thrift stores, the 3 thrift stores in town, to fairly quickly get them money that they need to use for bedding purposes, for showers, and for people to be able to access laundromats. Each congregation will be asked to contribute a certain amount. We'll sort of say, I think this will be the plan. Don't swear by it. that each congregation will be asked to say, this is how many active members we have. We're going to try to raise $10 per active member. So for us, that would be like around $1,300. That will be our short-term project, hopefully done by Thanksgiving, before the cold weather sets in and helping more people stay indoors at night. We want to have a long-term project or projects that are going to be something that our congregations commit ourselves to and plan to stick with for 1, 2, 3 years. And we've got sort of a list of possible ones that might be very fruitful. So we'll have to decide about that next. We've got organizational things to pull together as well. Margie Stockton, many of you know, she has been organizing meals here once a month to go down to the St. Elizabeth shelter. Margie is enthused about switching that over to the Pathways shelter, and the goal would be, first she gets her feet on the ground with us doing that and working with Pathways shelter, and then next trying to get more and more congregations to do the same thing, because the shelter is providing 2 meals a day to 50, 60 people. Huge drain on them. And so if there were 15 nights a month, let's say, that churches provided all those meals, it would be a huge help to the shelter. So I'm really excited that Margie's interested in pursuing that. So this seemed like a pipe dream 4 months ago, but it's been pretty amazing to watch it unfold. I'm really hoping that other congregations around the county will say, this looks good, you're really doing something, we want to get involved. If we can get up to 10 or 12 congregations, you know, I think that would be pretty amazing. But time will tell. Seven is good. It's a good lucky number. So any support any of you folks can give with this, especially as we start trying to raise that $1,300, please do what you can. Thanks a lot. We'll take Q&A here now. Yes, ma'am.
Oh, thank you. Yeah. Sorry, I just got over a bug, and I know my voice is a little out of it. I want to thank Jake for his very passionate, emotional talk. Thank you. My name is Corinne Fairbanks, and I came with Jake a few years back, and I was hired on as the assistant manager because of funding, but I kept on as a volunteer. And so Jake and I have done a lot of cooking for that shelter in the past 3 or 4 years. And it's been a loving joy, you know, because people forget that food is a human right. People forget that housing is a human right. It's a basic necessity. I've been with Jake when we've gone to city council meetings and had business owners saying that homeless people should be shot. I mean, he didn't mention this, but I felt it important to bring up that the amount of education that needs to happen on a community level is so imperative. People don't understand how the brain mutates after grief and loss. They don't understand how the brain mutates after trauma. They don't understand how being on the street is traumatic itself, especially as a woman. If you're a woman out in the street, you are open to any kind of predator. It's predator season, unless you have people to protect you. And people only want to protect you if you have something to give them back. So, I mean, there are various levels, but the main thing is education. How do we educate the rest of the community to find it in their heart to be compassionate, but also logical and loving and community sustaining, to be there for their neighbor? Because no matter what, these are neighbors. These are people that have generations, have lived there for generations. And not only that, you go back a couple hundred years, this area has a lot of amazing historical trauma. I don't know what your feelings are, but as a Oglala Lakota woman, I'm very familiar with historical trauma, which I was telling your elders here that I found it very fortunate to be here on a day that you were recognizing water as not only a way of life, but also as a fluid prayer. Because water, in 3 days, we die. I mean, you're composed of 90%, I'm composed of 90%, I'm having a bad day. You might end up having a bad day with me if you're sitting next to me. But there's been studies shown on how we interconnected. One of the things that I think is so important too with that education is also learning how to educate people on how to do healthy self-care. Because that's the other thing that comes along with addiction and substance abuse is getting away from all the trauma. How do you do that without the addiction, without the substance abuse? How do you find a safe place to find respite from your mind, and safety? But these are all, again, these are layered discussions, but they're discussions that need to happen, not just here in Los Alamos, not just Espanola. By the way, I also work for LifeLink. We are very proud of our pallet homes, our SOS program. They're doing phenomenal. But they do take a lot of work, and they do take a lot of money. Security 24 hours. But again, thank you again for allowing me to be here. I'm excited to see so many people here. It brings my heart a lot of joy and love for this morning. Thank you.
Thank you. Thank you. Okay, I'll wander around here. Who else has questions or comments?
I was wondering what kind of health care, just general health care, is available for this population, and especially now we were just talking about COVID and vaccinations, and I saw a notice in the paper that it's quite a possibility that COVID shots will not be available to people without insurance very soon. Yeah, and so I wondered if some of the proceeds from whatever monies are collected could go toward funding that kind of thing, because community health is a very, very vital thing to take care of, because if part of our population is not vaccinated, then, we're next. So quite a long-winded question, but I just wondered if they do get at least basic health care, and if so, who is providing that?
Mm-hmm. Yeah, thank you for your question. As of today's date, El Centro Family Health in the Healthcare Commons of Espanola does provide basic health care to the indigent and the unhoused. So pretty much anybody without health insurance can go in there and get your basic wound care, tests and vaccinations there. And there's also, from there, there's also case managers and the like also. But I know they are overwhelmed, and it's not so accessible to the unhoused all the time. So we are planning. We have a plan with La Familia. There's healthcare for the homeless that's based in Santa Fe. They're going to do a pilot project at the shelter, and so they're going to open a clinic 2 times a month. That is going to be no appointment necessary, walk-ins completely welcome, and they can also do pretty much anything that urgent care can do. Also, they can do prescriptions, they can do diagnosis, which is there's so many things that are connected that in order to get onto paths of recovery, right? It starts with just having some basic assessments, And those assessments have to be signed on by a nurse practitioner. Sometimes in order to get medications, you need prescriptions. Sometimes if those prescriptions are across town, that's inaccessible for an unhoused person to go across town. They might not be welcome in that store anymore, that pharmacy anymore, right? They're not, maybe they're not allowed in Walmart or Walgreens or CVS for some other reason. So then their prescriptions are become inaccessible. So then they stigmatize themselves. It goes down the path of shame. They can't get out. So we are trying to address the barriers, and yes, healthcare is a huge one. Where even the hospital is inundated. Presbyterian will take. I mean, they'll take them, and there's some successes. Dr. Ketchum is a leader at Presbyterian in terms of getting people on various medically assisted treatment programs, Suboxone shots, which are like a once-a-month dose, which are, I mean, this is phenomenal research being done because they don't have to go in every day. For like a methadone dose is more like every day. Suboxone has a little more, there's less side effects, there's less withdrawal symptoms for some people. It doesn't work for everybody, like I said, but there's things up and coming in the medical field that can taper down opiate addiction. And that is what we're going for. That's what we're trying to access more of. Porch Light is a new center in Espanola that's groundbreaking and offering multiple levels of medical assisted treatment that's on walk-in availability. But yeah.
Let's see, I guess this is on. I had a couple of questions. It sounded like a fairly good number, if not most of the homeless are local or have local ties and roots?
Yes, sir. According to our data, according to our intakes, they're almost all from Rio Arriba County, Espanola Valley.
Wow.
Probably 90%. We do have some transient folks. There's plenty of rumors out there who want to distance themselves from the unhoused situation and say that they are not from the community, but they are. They have, most people want to say, oh, well, they are human beings. But to me, it's one step further. They are mothers, they are fathers, they are uncles, they are children of people. So they're not just like, some human being somewhere from somewhere. They're actually from our community. They are relatives. And yes, it's a difficult journey that they are on. And sometimes it's just too much for families to continue. But yeah, they're almost all entirely from there.
Thank you. My second question had to do with, you were saying how you were having some success rate and numbers were going down at one point, getting people into rehab and long-term, whatever. What I was wondering is, do you have a sense of recidivism in spite of that, or is that a problem?
Yeah, I mean, recovery is never a linear path, right? Recovery is a meandering root system that all comes back into various circles, and we never know when somebody is actually going to blossom into a bear fruit, right? So there's plenty of people. Well, they just can't. That's enough. They've had it. And there's issues within treatment centers. There's issues that go all level. People just don't necessarily have the capacity. Treatment centers don't even have enough employees and case managers there to deal with the issues. So often people are left in rooms for days at a time, basically getting very little maintenance, very little care. So we have to look at care within treatment centers. We have to look care within detox centers, and we have to increase their accessibility. Walk-in detox. Where is that facility? You know, detox appointments are really hard to get because they're backed up, you know, and that's, you know, we're working on that in Hispaniola. But it's probably a 5 to 10 year plan to get a detox center in Hispaniola. But it's going there.
I want to just comment on that, that was a striking thing that we learned, that for people to get into medication-assisted treatment for their substance use disorder, they usually need to go through detox. There is no detox center in Espanola, so they end up, you know, maybe if they're lucky, going to Santa Fe or something. And yet, the medicines that Jake was talking about that have now come available, the injectable form of Suboxone, the Porchlight Clinic, we interviewed 2 people there, and they're based out of Colorado. They got like 30 clinics all over Colorado, buses that go to small towns, and they say that about 30% of their clients in Colorado are on these injections. And so it's not for everybody. People have to kind of sort of fit certain criteria, but it offers a real hope. But there's problems with the treatment centers in Espanola getting the Suboxone they need, the injectable forms that they need, people getting to the clinics. You know, in some clinics they need to have insurance to get started. But to me, as a retired physician, this to me looks like a very promising area for us to potentially work on. But as I mentioned, we made a list of possible things we could focus on as long-term projects, and there was 18 things on there. So, you know, what we want to do is figure out what's most effective, efficient use of our energies and our monies, and what's realistic for people from Los Alamos County to be doing, who are just a loose affiliation of congregations.
Well, what we do know is that people will not go into recovery if they're not being fed. They will have a less likely chance of going into detox if they haven't had a good night's rest in many, many weeks. So we have a shelter first philosophy. Shelter first, feed them first, then talk about recovery, then talk about next steps.
And yeah, I'm Joe Dudziak, Chaplain Joe. I run Chaplain Joe's Street Outreach. We're mostly in the Santa Fe area. We do 0-degree sleeping bags. We do 0-degree sleeping bags. We've handed out over 500 in the last year. We send a few up to Espanola, usually a couple up to Los Alamos. And, you know, with the addiction, I see it all the time. I volunteered at Pete's Place for over a decade, and they do have a detox in Santa Fe. They need more because I've seen it dozens of times, literally dozens of times, because something really usually has to happen for somebody to say, I need to go to treatment. Yep. And so I've seen it, you know, like I said, literally dozens of times where the person that's on a Thursday, I need to get into detox. Okay, we got a slot for you Monday. Well, guess what? Monday they're not interested in it anymore. And so that's one of the things for the drug addiction is they need to get straight in. And the other thing, I agree with everything you said. And they're people, and I have heard people say, oh, they all need to get shot. You know, I heard an officer once, and I'm not knocking the officers, but there was an incident at a Dollar Tree, and I was talking to one of the officers, and he goes, these people all need to go away. And I said, well, where do you want them to go? And he goes, jail. They should all go to jail. Well, that's pretty short term, and they take people to jail, and then all their stuff gets stolen, and then they wind up not having IDs. And it's really important to educate people that the homeless are people. And a real quick story, we were handing out our stuff in the middle of winter, to this guy and his wife. They were in their late 20s, and they had an awesome dog named Daisy. But anyway, we were handing out our regular stuff, you know, lunches, sleeping bags. And he said, yeah, I just had a job for 8 days, but I had to quit. And he said, I think they thought I just wanted to get a paycheck and quit. And he goes, but what the deal was is I stunk. or I stink. He goes, they didn't say anything about it. He said, but I knew, I could smell myself. And he goes, and then second, and this is one thing people don't realize, if you're out in the street, he said, I can't sleep. So I'm severely sleep deprived. And thirdly, and this was at the middle of winter, so 6 o'clock, it's dark. He said, thirdly, I'm leaving my wife out in the street alone while I'm working. So I had to quit and take care of my family. And people do not understand that.
Thank you, Joe.
Thank you. I just wanted to refer back to this gentleman here. One of the things that I like to ask people is like, how many people here are diabetic? Anybody diabetic here? Well, that's great. Okay, so, okay, pre-diabetic. So when we talk about the recidivism rate of addiction and substance abuse, we have to, if we look at it as a disease, we can compare it to diabetes to a certain extent. Because if you don't take care of your diabetes, it's going to affect your moods. It's going to affect the way you think. It's going to affect your decisions and your planning process. So you've got to take care of it. You've got to maintain it. And hopefully you don't become insulin dependent, but then there's that if you do, right? There's still ways to be healthy. I've heard people in recovery say that the recidivism rate to substance abuse compared to diabetes is actually better than diabetes because people find comfort in food and people have memories and people are connected, culture, spirituality, family to food. So it's very difficult to change your lifestyle to all of a sudden accommodate being diabetic and having to change your family's cuisine or what they eat to be able to support what you're going through as well. But also when you are in the middle of substance abuse and you're struggling with that addiction, you often don't care if you're eating or not. So can you imagine if you're not eating very much, you're not drinking water very much, you're not able to take good care of yourself, the decision-making processes that you have available to you, you're constantly anxious. I mean, that's it's a very narrow line until you find that respite, until you find that safety that every person that I've met, whether they have a home or not, is still looking for. You know, so yeah, I just wanted to kind of connect with you on that because that issue of health is a huge one. I know I make better decisions when I'm feeling good than when I'm feeling sick. So, but I wanted to get back to what you were saying. Yeah, one of the things that we had heard at a city council meeting was someone saying, well, we're just going to get a bus, pack them all in the bus, and take them to Santa Fe. And it was like, we were thinking, they're just going to come back in a couple hours. I mean, this is their home. And again, it's like, I've heard Jake say it a couple times about human beings. It was an eye-opener for some of these people in city management to start viewing these people as people and not just people that need to go to jail and be hid away. So if you think about it, it's like what's going to happen if you go to jail? You're going to lose your home. You're going to lose your job. You're going to have no family support. Who can remember other family? I have a cell phone. I can't remember my own son's phone number because everything is on there, right? I can only remember his number, thank God. So I'm just saying that it's like you lose everything, contact. Public defenders are so backed up, you're lucky you actually get heard and seen before your court date, if that. So again, we're talking about layers and education and all of that. But thank you so much for what you were saying. I appreciate what you do. And
Yeah, thank you both. I have a question because I was in Oregon for a year, and I know like in some of those communities and where I was in Eugene, they set up these types of initiatives with like safe spot areas with the pallet homes or the tiny homes or however they were doing it, right? And so, so glad that Santa Fe is starting to do this, and then that you guys are getting some of that access too. But, as people here in Los Alamos and and Tyler and Jeff and their group and the interfaith group working on all this, like, yeah, where can we interface with even some of that, the pallet homes, and getting, connecting with other churches and faith communities down there, right, to give some land to create those spaces? Is it money? Is it volunteers? Is it staffing? Is it all the things, building? And I guess maybe that's more long term, right? But I'm just thinking that those I know have worked in other communities, right? So yeah, where can we go with that into the future?
Well, I guess one way that I've come to look at it is there's 4 of us who've been doing all these interviews, gathering the information, trying to understand that. Then, we're giving summaries of that to this bigger group of representatives from congregations, and then we now will have a flyer going out to congregations so they will know what this group is about. And then hopefully each congregation like ours will start having more programs to educate ourselves, to start looking at where are volunteers needed, where is money needed, where are letters to state representatives needed, so that each congregation can start to become a lever helping with parts of this.
So we have a perception problem. We have to rise against the community's stigma that hates homeless people and categorizes them as lesser than other. So right now, because of the strong public eye in the media, people in Espanola are on edge, especially business leaders, churches even. They want to, or they are basically saying that all the crime in Espanola is caused by homeless. Santa Fe's dealing with it too. That's why they want to relocate Pete's. And they're getting a huge amount of throwback for that. So we as a shelter, we get the flack from all of the crime in our surrounding area. They have no data on whether or not the crime is actually caused by homeless people. They're not willing to do that work. They just want it away, right? And they're easy target. The fact of the matter is that there are people who do all kinds of weird things against the law, and they're from all walks of life. They're not all homeless. The only issue is that the homeless is more visible. They don't have a home to go. They don't have that safe harbor that shows them, that keeps them out of sight. So when we've approached people, like churches, for example, churches are the leaders in Santa Fe who are welcoming safe on sites. So we've tried to do that in Espanola, and we get very hard-edged stigmas. And so our approach now is to create more community events, more education, share stories. We want to. It's so hard because we want the unhoused to share their story and give testimony, right? But even who wants to out themselves in a community like that? I mean, I was shouted off at a podium, my life threatened at a public meeting because I said I advocate for the homeless. It's real. I mean, it's what Corrine and Joe are talking about is like, it's you stick your neck out there, and the unhoused don't really want to stick their neck out all what they already are, right? So we have to create these safe spaces where it's Recovery Month. September is Recovery Month. Let's focus on recovery stories. Let's build community events around the recovery as possible, but also recovery is welcoming. It accepts all people of all walks of life in their journey towards recovery, meaning you can be in recovery and still in active use. You don't have to be sober to be in recovery. That's not what recovery is all about, right? And so we have to widen the circle. We have to educate those, because really hate comes from ignorance and fear based on ignorance. And so we have to have more planning and more grassroots work. I think what we learned from this winter is we said, okay, we're good. we thought we were up a level. We thought we could get ahead of the community, build it first, and say, get apologies later, say apologies later. And that didn't work. That backfired. Grants passed didn't help. The Supreme Court case that basically ruled that all city ordinances could sweep camps upon whatever. And that's exactly what the city of Espanola did. Grants Pass was ruled on, and the city of Espanola 1 month later moved in on the encampment and said that their sanctioned encampment that was in writing, we did it, but they were like, no, this is going to go. They created an ordinance that basically said all camping inside the city ordinances was illegal and a public safety hazard. Things like panhandling. The city of Santa Fe is creating panhandling laws. Well, you have an issue where you don't have enough employers who are willing to take risks on even employing the unhoused. Why not? It is happening in other places. Salt Lake City, of what I hear, they are employing within the city they employ unhoused people to clean up parks, et cetera, and they are city employees, but they don't require an address. They don't require that they need to be housed or have permanent housing. These types of systems help people get to a better place.
Hi, I just had a question about your guys' model for is it completely sobriety based, or are your rates of recidivism, do you take into account moving out of a period of chaotic use towards consistent use? Because or is it 12-step based, or do you guys work with harm reduction in the area? What is your model of gauging improvement when dealing with people experiencing addiction?
Are you speaking at the shelter?
At the shelter
specifically?
Yeah. Well,
okay.
Generally in the area.
In the area. So I can speak from the shelter as an organization, as an agency that I represent, that we come from pretty much a harm reduction model. We accept anybody inside the shelter. It doesn't matter. They could be in active use or not active use. We don't ask any questions. We don't require, but we're a non-residential shelter. Okay, so St. Elizabeth's is a residential shelter that requires sobriety in order to be there. So that means people can be there 24/7. They have rooms there, but you have to be sober, and you get drug tested and breathalyzed on a daily basis. So we don't do any of that. We're more like Pete's. Pete's is a low barrier. Now, the field of low barrier is changing a lot because of fentanyl and because of other issues, right? So like I said, fentanyl has this really low withdrawal basis. So how do we provide shelter from people who are constantly going into withdrawal and they don't want to spend a full 12-hour night or a full 8-hour night? They can't do it. So what we're trying to plan for is more of a walk-in warming center, so that they come in out of the cold, they can get a hot cup of tea or coffee, they can sit in a warm room for a while, they can calm down, they might have a place on the floor where they can lay a mat or sit on a couch, and there'll be people like myself, direct care providers, to talk if they want to talk, or be there for somebody to listen to, or whatever they need. That to me is a first step. They come in the door. It means they want help, but they don't really know, they don't know how long they can get the help for. They don't know how long that is. And so we just need to provide them a window that's more open, instead of shutting the window behind them and saying, well, now you have to follow these very, what they would seem strict rules. For us, it's very basic stuff, right? But, yeah.
Have you seen improvement in your cases without people necessarily looking for sobriety? Have you seen people that move towards more of a chronic use while also becoming housed and being able to maintain a job?
Yeah. One story that I really like was I was working with an older couple. They were in active use for a long time. I knew them. I knew their daughter, and finally the wife of the couple decided, that's it. I'm ready, I'm done with this, I don't want to sleep on your porch no more, I want to quit all this mess. And so we got her into Santa Fe recovery, and her husband followed through. And I mean, it was long, right? It takes a lot of time, but we stuck with them. We had a case manager basically on the phone, on call with them as they went in through their recidivism process, in and out. There was issues with, going back to COVID, right? So like sometimes the detox center will break out in COVID, and then they release all of their patients into hotel rooms. And so this poor individual got there, was ready to get well, and then they released him to a hotel room. Well, what do you think he did in the hotel room? I mean, like we had to get access, we had to find where he was, because we had to place, certain release of informations, and like, it's a process. So we did stick with the couple. They did make it through. They did 6 months of recovery, and we were there on their exit, and we were able to find them transitional housing in their house today. We have success stories like that. It requires an immense amount of persistence. We at the shelter, we have 3 employees. 3. For 60 people.
So we're at 1 o'clock and about time to wind up here. I want to leave you with a few numbers. At least as of 2022, and I'm not sure if this is what the current number is, but as of 2022, Rio Arriba County had 4 times the overdose death rate of the nation, 4 times the rate of New Mexico. They have 12 times roughly the level of homelessness in the Espanola area that we have in Los Alamos. We're concerned about it in Los Alamos. We have 20 people. They have about 250 people in their community, which is smaller than Los Alamos. They are 18 miles from us. They're not in another world. It's just 18 miles. So those are 3 numbers that I think say a lot and have a lot to do with why we're pushing ahead with this coalition. Thanks everybody for coming. Thanks Jake so much. This has
Thank
been
you, Tyler.
wonderful.
Thank you,
Appreciate
everybody.
it.
Thank you.
If anyone would like to continue the conversation, we're going to meet at the co-op for lunch, so you're welcome to join us.